I was scared that if he couldn't fix it, I didn't know what I was going to do. There's 3 of them I've seen, and none of them could do anything. What hope is there? I didn't know where I was going to go after that. I was pretty hopeless until I seen Dr. Ryba.
Mr. Trotter came in to see me. He had a significant injury. He had seen a few other different providers regarding this injury. When I saw him, he was in a lot of pain, and he needed help.
I broke my foot, and it broke in 4 places. I was standing up, and my blood pressure dropped, and I fainted, and I hit my foot got caught under a doorway, and I fell and hit the ground, and it just twisted my foot and broke it. Yeah, I was walking around on a broken foot. What little walking around I was doing, I mean, I had no choice, like going to the bathroom and stuff like that. The quality of life was terrible. I mean, I wouldn't wish it on anybody. Well, hearing that they couldn't help me between 2 of them, it really scared me. And then they told me about the 3rd one, which was Dr. Ryba. And I come over here and he said he could do it. And I was very glad to hear that, because he said that years ago, you would have to cut your foot off because the way mine was broke, it couldn't be fixed. Back, 80, 100 years ago. And I was glad to hear that he could fix it, and he did.
Mr. Trotter had an injury called a Lisfranc fracture dislocation, which is a condition where the bones in the midfoot are disrupted at the joint level, and sometimes there's associated broken bones, and sometimes the joints are displaced, and so almost always that requires surgery. And the goal of surgery there is to kind of restore the alignment of the foot so the patient can function again. Typically with this type of injury, if left untreated, it reduces the patient's function and ability to walk without pain or without deformity. And so when I saw him initially, I knew right away if he was healthy enough to undergo surgery that he needed it. And so we discussed that almost initially, as well as the conservative treatment options and things like that, and let him know kind of what the recommended treatment is and what the prognosis of his treatment is and things like that. And he was accepting to surgical recommendations.
Surgery didn't really scare me. I mean, I was welcoming it. If it could fix my foot, I was welcome to the opportunity to let him try to fix it. Absolutely.
When discussing surgery with him, obviously we kind of start from the most conservative approach to, kind of the most invasive approach. And obviously the goal with any surgery is to try to do, as minimally invasive as possible. With this particular injury, it requires multiple incisions, and it requires us to move and shift bones and put bones back into place with plates and screws and things like that. So you kind of lead in easy to that, but basically this is a reconstruction of the foot. And so when we talk about surgery, we kind of go over, the risks, the benefits, the alternatives to surgery first, understanding that. Again, I think he was comfortable with proceeding with surgery, and that was that.
After having the surgery, I was in a boot, and I still was off of it for a good month for the most part. Then I started getting around where I could walk around on the boot with my boot on, and that went on for another 2 months. Then he told me I could try a tennis shoe, and put a tennis shoe on, and it was painful for a while, but eventually it's pretty much all gone away.
In general, we try not to limit the range of motion of the foot or the ankle, and so there are some braces that we can utilize that allow full range of motion of certain joints of the foot and kind of take pressure off of the joints in other areas of the foot. In particular with Mr. Trotter, his condition he developed somewhat of a flat foot secondarily just because of the deformity of his after his injury. And so even though we repaired the middle of the foot, he's having some stress in other areas and stress on some of the tendons. And so we're fitting him with what's called a Ritchie brace, which will allow his ankle to move normally, but will kind of support the arch to take pain directly on the arch away, hopefully, and to kind of augment or support the ligaments and tendons as they move.
There's top-notch doctors over there, as far as mine was anyway. I'd absolutely recommend them. I would tell Dr. Ryba, it's been a great experience since I was talking to you. From the first day I met you, I liked you that day. And when you told me you could fix my foot, I really liked you.